One of the most abused federal programs also serves Americans most in need. If you just open the books, according to several investigations, a House committee is now looking to save $880 billion on Medicaid through existing recommendations to cut fraud, waste, and abuse. And joining us now to discuss is Open the Books Deputy Public Policy Editor Rachel O'Brien. Good morning to you. Welcome to the National News Desk. Happy Friday. So what are some of the worst fraud, waste, and abuse that you've seen in Medicaid that need to be addressed?
Yeah, so President Trump said the House committee that oversees Medicaid has to find that $880 billion in savings. And what we're arguing is that if leaders look at existing recommendations to cut waste, fraud, and abuse, they can hit that number. One of the biggest examples of that waste is in double payments. Between 2019 and 2021, states paid $4.3 billion in double payments to Medicaid insurers. This was because people moved from one state to another, and they did not, they didn't disenroll from one state before they enrolled in another, and these states continue to pay Medicaid insurers. This is only one example of 3 years worth of those double payments. This has been going on. An Inspector General report for HHS found in 2020 about $1 billion a year was being wasted on double payments. The director of the Medicaid audit said, it's low-hanging fruit. This data is showing this is a problem. We can tackle this. Another 2022 report, there was a recommendation to use national data to detect double enrollees. And the Center for Medicaid and Medicare Services said, we have an existing system that's adequate. Clearly, it's not adequate if $1 billion a year is being wasted on these double enrollees.
Yeah, and Medicare and Medicaid, right now, the largest contributors to these improper payments. How much money can be saved by preventing those?
Right, so Medicare and Medicaid, they are the largest problem for improper payments. In the last decade, they made over $1 trillion in improper payments.
Wow.
And that's the wrong payment to the wrong person for the wrong amount or for the wrong reason. If you look at all federal agencies, $1.9 trillion in the last decade. So if even half of those improper payments were prevented, that would be enough to save that $880 billion figure. You know, critics will argue if it was possible to save all that money, it would have been done already. We argue it wouldn't. You know, neither Congress nor the agencies have shown a willingness to do the hard work of reforming these decade-old systems that lead to errors or changing policies that allow the billions of dollars in payments to be sent out in error. They need to be willing to actually do that hard work.
Speaking of which, every year the U.S. Government Accountability Office does recommend ways to reduce some of that duplicated spending. So what have they said about Medicaid?
Oh, it's amazing. So since 2011, this report has come out and $667 billion has been saved across the federal government. However, there are 400 recommendations that agencies have left on the table. They haven't addressed them at all, including half a dozen recommendations to the Center for Medicare and Medicaid Services that they've left on the table just as far back as 2008. So one recommendation is to improve Medicaid demonstration waivers. Their process for getting those waivers, states need a waiver to test new approaches to running their Medicaid program in their state, and improving that waiver process, according to the GAO, could save tens of billions of dollars. Wow. There's another recommendation for how states comply with Medicaid supplemental payments. You know, if they start, the GAO suggests requiring states to submit audits to show that they're complying with how they calculate those supplemental payments to ensure they're not overcharging the federal government. Another savings there. You know, Congress and President Trump, they don't need to reinvent the wheel to find savings. They need to look at the work that's already been done and be willing to build on it and stop leaving this money on the table.
Yeah. All right. Deputy Public Policy Editor Rachel O'Brien, thanks for joining us. We appreciate it. Have a great weekend.
You too. Thanks for having me.